Okay, how do we make the choices for your supplements? This is not going to be in a nutshell, like I always say, but when I'll tell you how I do this. The Saguil approach to kind of figuring out what to take, where to spend my money, what to put into diet, what to put into pills or liquids is relatively easy if you ask me. So as anybody knows when they come to see me, my objective is to help my patients make lifestyle changes, to get out of the rut that they're in, and hopefully to feeling good again or whole again. Many times that means starting with some form of nutrition change, some form of activity change, and some form of relaxation practice. The activity change, the relaxation practice, I'll leave that for other videos. The nutrition has to be, I think, gently teased out. No matter what, you always have to eat. So that's why I think nutrition change is the easiest catalyst to change back to a very healthy lifestyle. Now, when you're 60 to 70 and you're only eating about just 3 small meals a day, it's hard for that patient to take in large volumes of whole food plant-based eating. Once we know what to focus on, that is where I spend most of my money or hard-earned cash as far as making a change. The lower ones, the lower priorities, I wouldn't spend too much money. For example, I'm a semi-vegetarian, so most vegetarians don't get enough B12, vitamin D, and iron in. So I take B12, but since it's one of my lower priorities, I don't break the bank with this stuff. I just get the cheapest possible. And I test and retest to make sure that the cheap stuff is making a difference. With regards to B12, I really try to save money by getting shots in my office. Usually a B12 shot once a month, just as good as the oral stuff, but that's what I offer to my patients, and there's other benefits to that too. So a low priority for me. Omega-3 fish oil, low priority for me. I've had the best cholesterol that I've had in about 20 years, maintaining at a semi-vegetarian state, and also with exercise and relaxation, the way I learned at Deepak Chopra's, the Chopra Center. But cholesterol is always looming in my future, so I try to maintain omega-3 fish oil. I don't want to go to statins. I don't think it's necessary to go to statins. As I mentioned, I take omega-3 for cholesterol monitoring. I also use it. The other benefits of taking the supplement are that it helps with joints, it helps with depression. This is great, and these are the side effects. These are the positive side effects of taking a supplement versus the negative side effects of taking a prescription. If for my colleagues who find high cholesterols, especially with the new guidelines for cholesterols, and they go straight to high-dose statins, I don't agree with that. I think you should always try to manifest a whole food plant-based diet first. Give yourself a chance with that. Try to empower patients with information and coaching, and then maybe going with fiber and omega-3 after that, and then maximizing on it, looking for side effects, kind of guiding the patient, and then seeing what happens after that. If you've done everything and you still can't get it, okay, high-risk people, you got to get on a statin, but doing a statin straight off and not doing this, I don't agree with. The unfortunate problem is a lot of people coming out of medical school, a lot of doctors coming out of medical school don't have nutrition change training. And that's why I'm trying to work with UIC Medical School and teach the young guys about nutrition in addition to basics of medicine. But because of that, we refer to registered dietitians. And the registered dietitians don't have that much time either. They have time for diabetes education, but they don't have much time for high blood pressure or cholesterol education. So you're on your own. So if you are on your own, have no fear. But if you're coming to me or one of the other integrative medicine doctors, we use evidence-based medicine. So we use evidence-based medicine in randomized controlled, double-blinded, placebo-controlled trials or studies, and that's the way we, as far as what we're taught, AZCIM, that's what we do to figure out what works best in evidence. And I sometimes will also go to consumer labs. Once I make a prioritized decision on what's most important, then I'll say that's where we spend. Number one is where we spend all our money. For me, because of the fibromyalgia trigger points I'm dealing with, or some of the body aches I'll have with tendon or delayed onset muscle soreness, I have turmeric and magnesium as my priorities. And when I decide what to go with, I'll go to consumer labs. First off, I'll use the evidence-based medicine to figure out if turmeric actually helps with inflammation or if magnesium actually helps, and they do. All the evidence-based medicine supports that. Then I go to consumer labs because they are independent, and they do very detailed testing on whether the capsule has what's on the label. And I think that's all they do. The quotes that they put are from the evidence-based studies that we go through as physicians, a lot of them based out of NIH. Your tax dollars and mine pay for that, and they'll use those quotes or use those studies. Now, aside from that, all they do is usually we'll check if the ingredient is in the capsule, and that's it. So in the form of, this is ashwagandha. In ashwagandha, with the consumer labs reviews, they take a couple different over-the-counter supplement brands with ashwagandha, and they check to see if it actually had what's on the label. They actually had some of my favorite brands, but they didn't get approved because it wasn't in the compound or it wasn't in the capsule or batch that they tested. So what was surprising to me with this particular herb, ashwagandha is a great herb for resetting your circadian rhythm or your clock. I use ashwagandha as an adaptogen in the morning to take care of calming my mornings when I'm under high stress, like Monday mornings, when my breathing technique doesn't work or my meditation doesn't work. I need extra bolstering up. Ashwagandha. So in trying to figure out ashwagandha, this is Vitamin Shop ashwagandha. I don't usually shop at the Vitamin Shop. But when I checked out the evaluation on Consumer Lab, they actually had Vitamin Shop, which is one of the cheapest, and it actually was approved. So what I would usually do for my patients is I would figure out what the priority is, kind of figure out the supplement, the nutraceutical that is good for that priority, the prioritized disease process based on evidence-based medicine, previous studies. And then I go here to figure out, okay, of all the different brands, which ones were approved. And I'll get a list of the ones that were approved. And then I go, that's where the feel part comes out. Once I have a list of the ones that were approved by consumer labs, then I'll leave it up to the patient to kind of choose between the three. I personally have usually tested out most of the supplements that I suggest for my patients in my videos. And that's the cool thing about supplements. Most of them don't have side effects, and I can usually play around with different supplements. And truthfully, a lot of the things that my patients, you guys have, I've either been through or had at one point in time in my life or another. So I will really be speaking from the truth when I tell you about the supplements I suggest, but this is how I figure things out. Not every approved supplement on Consumer Lab will help everybody, but you have at least a couple different go-tos that you can try. And I usually on my patient homework that I give, I usually list at least 2 to 3 different brands to try. So you can pick them out on your own. I shop at Fruitful Yield, sometimes at Whole Foods, sometimes on Amazon.com, and that's where I get mine. But you have your options. I have nothing that I sell in the office. I don't have any allegiance to any of those companies I suggested or those stores I go to. I am just an average Joe like anybody else with some symptoms and some standard American diseases. But I try to do my best to live a healthy life without having to have a major medical problem, hopefully, and without having to spend too much money.